citing failure of both the national and county governments in implementing the 2017 CB. In there, it was adequate, and they proceeded and commenced on the strike on the 13th of March 2024. Following that notice, the Kenyatta National Hospital moved to court seeking stay orders to injure the lives, safety, and health of Kenyans. The Employment and Labor Relations Court on the 15th of March 2024 ordered that a whole-of-nation approach be instituted towards resolving the instant long-running dispute in Kenya's health sector and for the purpose of achieving a sustainable solution. The ongoing negotiation and conciliation to incorporate the Head of Public Service, the Cabinet Secretary for National Treasury, the Cabinet Secretary for Public Service, the Cabinet Secretary for Labor and Social Protection, the Salaries and Remuneration Commission, to seek to comprehensively address all grievances leading to the strike. As part of the issues that were raised were classified to relate to the national government, while 9 of the issues were classified to relate to the county government. 4 issues fell under concurrent mandates of both the two. The main demand was failure to enhance the risk allowance paid to clinical officers. The union wants the risk allowance to be in 1,000 clinical officers in the country. Only 158 are in the purview of the national government. In the same breath, on the 26th March 2024, the Kenya Union of Medical Laboratory Officers issued a strike notice citing failure by the government to formulate and sign a recognition agreement with the union. The second issue is failure by government to confirm to permanent and pensionable all UHC staff, COVID-19 employees, UHC interns, and National TB and Lung Disease Program Fund employees. The other demands that were raised were all discussed. Impact on healthcare services. This has resulted in unavailability and delayed in help due to catastrophic health expenditures and adverse health outcomes for the population. Ultimately, the country stands to lose gains made in key health indicators, including maternal health, HIV, TB, malaria, and NCDs. From our checks, referral facilities, specialized outpatient services are significantly affected at 33% and 25% reduction in specialist and outpatient services. So what has the ministry done in terms of the crisis that is here? I want to confirm that the ministry has categorized this into 3 issues: short-term measures, which we are already working on it, medium-term measures, and long-term measures. In the short-term measures, the ministry has already posted interns in lines with the SRC advisory, 1,207 posting letters for 1,210 medical officers have been sent to the respective interns, and their names have been published the 15th of March, which is from National Treasury of release of 200 million. So requested SRC to advise on the demand by the Clinical Officers Union to have the risk allowance increase. We understand that this is going to have an impact on the overall budget, and that is why we have requested SRC to give guidelines. Once SRC gives the guidelines, then the ministry will be in a position to work towards implementation. The ministry officers, collaboratory officers have met of health is reviewing the internship policy to address aspects of the program, including the need to transit to internship without any delay. As it is now, what we are experiencing, the interns who have been out, some have been out for more than a year. And this actually delays them from getting the license that they need to practice. So the ministry is working on a policy, and yesterday we finalized internal stakeholders validation. Next week we shall be finalizing on external stakeholder validation, and is to invite the Senate that this is a place that we think that we can benefit from the wisdom of the members during the external stakeholder validation. The ministry is also ready to negotiate on the CBA, that is the new CBA, because the CBA under KMPDU, it lapsed in 2021. But we are aware that from the Ministry of Labor is that once a CBA lapses, until a new one is signed, that is when it comes into effect. On long-term measures, from production, supply, internship, regulation, employment, retention and distribution of stock density, skill mix and motivation, productivity, and general management. The ministry is also in the process of to ensure that the HRH matters are handled permanently. So we seek your support. And Speaker and honorable members, stems from the reason that we now have very many interns. Previously, we only had one university that was training doctors, University of Nairobi. At the moment, the country has 8 universities that is training doctors. Each year, currently we have over 1,000 graduates from the universities. The internshalists have not increased in tandem.
On highway, the way they so wish, causing a lot of confusion in the roads. Madam Speaker, sometimes even when the lights are off, when the lights are on for pedestrians to move, you find that motorbikes are moving and causing a lot of accidents in the country. Madam Speaker, I also know of, I don't know,